Okay, we are going to have an adult conversation this morning, so you may want to take a moment to send the kids out of the room, maybe to go brush their teeth. All right, this morning we have America's favorite dermatologist, Dr. Tess Mauricio, in here, along with Charles Runels. Now, men have Viagra, and women, you now have something too. This morning we are talking about the O-Shot. Thank you both for joining us this morning. We do appreciate it.
Thank you.
All right, Dr. Runels, I'm going to start with you. What exactly is the O-Shot?
So I just happen to be lucky enough to be working with platelet-rich plasma, which you've heard about here from Dr. Tess. It's used, the dentists have used it forever, the orthopedic surgeons to regenerate tissue. Dr. Tess has been using it to rejuvenate the face with the vampire facelift. And it just, because of a woman's problem, I explored the idea of using that same material to rejuvenate the vagina, and was lucky enough to happen on something that is really working extremely well for problems in the vaginal tissue.
So these are typically women who were unable to achieve orgasm a specific kind of way, and this is changing their lives?
Sometimes. That can be part of it. There are really 4 ways that women suffer with sexual problems. They can have trouble with arousal. They can have trouble with, once they get started, with the actual becoming more aroused, trouble with pain, and trouble with orgasm. And those problems are actually more prominent in younger women, and about 40% of women. And what's so tragic about it, it's a hidden pain. They often don't tell their husbands. Research shows they seldom talk with their physician. The physician avoids the subject because there's not good treatments for it. And we don't propose that this is some magic thing. There's still a need for sex education. There's still a need for good health.
Sure.
There's still a need for hormones if women need it. But you know, as an internist, I recognize this is an area, the most difficult problems of the vaginal tissue are often handled by a dermatologist. And I recognize I needed a dermatologist, preferably a woman dermatologist, who could relate to women to help explore how to improve the injection and how to communicate to women that we have a solution.
Let's bring in Dr. Tess. Yes. I wanted to, when I talk to you and America's favorite dermatologist, we're usually talking about things with the skin and preventing skin cancer. I had no idea that this would be in your field as well.
Yes, well, you know, there's mucosa there, and part of our training is actually dealing with diseases in that area. And so, you know, Dr. Runels and I work closely on the vampire facelift, and then now the time machine, which we've talked a lot on this show. And so when he started talking to me, and I believe in the power of platelet-rich plasma, and it's tissue. Tissue is tissue, and if we can regenerate the tissue, if we can thicken it, you know, and make it better somehow and healthier, and I know we could do that on the face, the neck, parts of the body using PRP, why not, you know, the vaginal area? And so when I started doing this procedure, I was really surprised at how many women actually have issues. I mean, even just my staff, when they found out Dr. Tess is going to do the O-Shot, they're all so excited. And then they started opening up about, oh, I have this issue, like I haven't had sex for 20 years, I have pain after my hysterectomy, I just have no more desire. And they really do not even want to talk about it because they don't think there's any potential solution. And this is such a simple procedure. It takes about, I mean, after we numb, you know, with a topical numbing, it takes maybe 15 minutes.
15 minutes.
And they're out, they're driving in, they're walking out, and my patients are actually saying, you know, even a few days after, they're like, some of the women who actually even have urinary incontinence are saying that when they sneeze, there's no more pee coming out.
Yeah, and you know what, I want to make sure that we get time for this because you're offering a special right now. You will offer the O-Shot introductory special for the month of February, which includes a free consultation and $250 off the O-Shot treatment. That's happening at your offices right now.
Happening at the office, and you know, if you have any questions, if you're intrigued, you call the clinic. We'll give you a free consultation. You know, the O-Shot is actually featured on the cover of Harper's Bazaar
magazine.
And Dr. Runels, I'm just so happy that we get to really work together to help pioneer and help so many women out there who are silently suffering.
Thank you both for coming in this morning. We really do appreciate it. If you'd like some more information, go to our website, san diego6.com, and click on San Diego Living.